wasn't enjoying my job because I was treating insurance companies more than I was treating the patient. I came across somebody who was doing this thing called direct primary care. And there were a couple of practices in North Carolina that were doing it. I think people would be willing to pay me a minimal fee monthly to take care of their needs, especially if they couldn't afford insurance or couldn't get insurance. And so I did. I just jumped in with both feet. Initially I called a couple MDs, and I wanted to have a female MD so we could, work back and forth into practice. And I must have called 7 or 8 people that I knew that I'm working with, and they said, "Oh, that'll never work in this area. You'll never make it. I don't really want to be a part of that." So I finally decided, look, I don't want to deal with the partner anyway. Let me just go ahead and do this on my own. I know I can make it. And because I had known a lot of patients anyway. And so I did. I didn't advertise. I went to the newspaper and I said, hey, I'm going to open up a different type of practice in Elizabeth City. Would you guys like to do a story on it? And they came out and they did a whole story on direct primary care and me and the practice. And that was my only advertisement, was a newspaper article. And I just got on my equipment, hired my nurse, who was a nurse of mine previously at the family practice office. So it was her and I. We stood at the door, opened the doors on October 1st in 2014 and said, okay, let's wait. And I had and actually, I remember the guy that came in.